Hey everyone, Dr. Jeff Werber here. Welcome back to the channel. Today we're tackling a topic that's close to every dog lover's heart, canine parvovirus, or parvo. This highly contagious and potentially deadly virus is a serious threat to dogs, especially puppies. But the good news is, with early detection, aggressive treatment, and proper prevention, we can give our furry friends the best chance of fighting this off. We're going to cover the ins and outs of parvo, from the telltale signs to effective treatment options, and most importantly, how to prevent it in the first place. One of the most common and alarming symptoms of parvo is severe, often bloody, diarrhea. If you notice your dog having watery, foul-smelling diarrhea, especially if it's tinged with blood, it's time to get them to a veterinarian immediately. This isn't your average upset stomach. This is a major red flag that something is seriously wrong. Along with diarrhea, vomiting is another hallmark symptom of parvo. This relentless vomiting coupled with the diarrhea leads to rapid dehydration, which can be life-threatening, especially in puppies. So if your dog is struggling to keep anything down, don't wait, seek veterinary attention right away. When our bodies are battling an infection, one of the first signs is often a fever, and it's no different for our canine companions. Parvovirus often causes a high fever, typically above 104 degrees Fahrenheit. If your dog feels unusually warm to the touch, or if you have a rectal thermometer and can safely check their temperature and it's elevated, contact your vet. We all know our dogs have boundless energy, right? So when they suddenly become lethargic, withdrawn, and just not their usual playful selves, it's a major cause for concern. This lack of energy, combined with the other symptoms we've discussed, paints a clear picture that something is definitely amiss. The relentless vomiting and diarrhea caused by parvo can lead to severe dehydration, and this is a very serious complication. You can do a simple check at home by gently lifting the skin on the back of their neck. If it doesn't quickly spring back into place, that's a sign of dehydration. Parvovirus wreaks havoc on a dog's digestive system, making it difficult for them to absorb nutrients from their food. If you see your dog's ribs or spine becoming more prominent, or if they're just looking thinner overall, it's another sign that something is seriously wrong. Parvovirus inflames the lining of the intestines, leading to significant abdominal pain and discomfort. You might notice your dog whimpering or crying out, especially when you try to pick them up or touch their belly. Now let's talk about treatment. One of the cornerstones of parvo treatment is aggressive fluid therapy. This involves administering fluids intravenously to correct dehydration, replenish electrolytes, and support their overall circulation. While there's no specific cure for the virus itself, antibiotics play a vital role in parvo treatment. Antibiotics help prevent and treat secondary bacterial infections, which can be life-threatening if left unchecked. Anti-nausea medication is essential to control the vomiting, which in turn helps prevent further dehydration and makes your dog more comfortable. Just like when we're sick, rest is crucial for dogs battling parvo. They need a quiet, comfortable, and stress-free environment where they can conserve their energy and focus on healing. Getting your dog to eat can be a challenge when they have parvo, but providing nutritional support is essential for their recovery. Close monitoring is crucial throughout the entire treatment process, including frequent physical exams and checking their hydration levels. In many cases, hospitalization is necessary to provide intensive care and supportive therapy. This allows for around-the-clock monitoring, administration of IV fluids and medications, and early intervention if any complications arise. The prognosis for parvo depends on several factors, including the severity of the disease and how quickly and effectively treatment is started. For dogs that receive prompt and effective treatment, especially puppies who haven't become severely dehydrated or developed complications, the prognosis is generally good. For dogs that receive delayed or inadequate treatment, the prognosis is more guarded. They may face a longer recovery period, a higher risk of complications, and may not regain full health. Unfortunately, for dogs that are severely ill, have underlying health conditions, or don't respond well to treatment, the prognosis is poor. Now for the good news, Parvo is highly preventable with vaccination. Puppies should receive their first dose of the vaccine as early as 6 weeks of age, followed by booster shots every 3 to 4 weeks until they're around 16 weeks old. If you suspect your dog has parvo, it's crucial to isolate them immediately to prevent the virus from spreading to other dogs. Parvovirus is a hardy virus that can survive in the environment for months, so thorough disinfection is key. Use a bleach solution, 1 part bleach to 30 parts water, to disinfect any areas where your infected or suspected dog has been. Good hygiene practices go a long way in preventing the spread of parvo. Wash your hands thoroughly with soap and water after handling any dog, especially if you've been around a dog with parvo. Until your puppy is fully vaccinated, it's best to avoid contact with unvaccinated dogs or dogs with unknown vaccination histories. So, there you have it. Everything you need to know about parvovirus in dogs. Remember, early detection is key. If you notice any of the symptoms we discussed, don't wait. Get your furry friend to the veterinarian immediately. Vaccination, along with good hygiene and responsible pet ownership, are the best ways to protect your beloved companions from this potentially deadly virus.